So when we're discussing opening a sterile field, it's really going to be all about boundaries, because considering Casey is in an unsterile role, that means that she cannot allow her hands or anything on her body to touch a sterile field. So we all learn about boundaries. Right now she's trying to open a sterile supply and get it delivered onto a sterile field. And then we also make sure that the item that we opened, the packaging was in perfect condition. We wouldn't want a hole in that packaging, because then the item would be considered unsterile. So we also are very concerned when we are trying to deliver an item that we're not going over the top of a sterile field, because to be honest, we live in a world of gravity. The fact that gravity can drop our skin cells onto sterile fields and cause contaminations, which then can cause sterile or infections in the surgical field. So we have to pretend like we cannot reach over our sterile fields, or else we're going to end up with possible surgical infections, and that's not an option for a surgical patient. So opening a sterile field can be extremely important, and making sure everything's done correctly is very important. And the fact that after you're out of the program, we can't stress enough, you continue practicing perfect aseptic behaviors. Thank you, Casey. Okay.